Dear friends, Namaskar. I am Dr. Anil Taneja. Today, I will be talking on how can we manage a patient of Omicron infection at home. As we all know that the Omicron is spreading in the whole world at a very fast speed. Even all those cases who have received 2 doses of vaccine, even to many who have received the booster also, even they are also getting this infection. The lucky point, the good point is that this infection is relatively much milder. Not so many patients need to be hospitalized as compared to the previous variant's infection. Common sign symptoms are, most of the cases they are asymptomatic. They don't have any symptom. However, in some cases we see there is fever which can be low or high. There can be headache, body aches. There can be throat irritation or scratchy throat. There can be some fatigue or weakness. In some of the cases there are flu-like symptoms such as sneezing, running nose, stuffy nose. Other symptoms such as loss of smell, loss of taste, or decrease in the oxygen saturation. These were quite common in other variants infection. It is not as commonly seen with this variant's infection. To confirm the diagnosis, we need to do a rapid antigen test or RT-PCR test. Since the virus has taken the form of a pandemic and many people they are suffering from it, so in such a state, any patient suffering from these symptoms or any of these symptoms should be presumed to be suffering from Omicron infection. Other tests like CBC, CRP, D-dimer or many other blood tests or CT chest, which we were doing quite commonly with other variants infection, are not needed to be done here. These are needed only in very few cases, and it's better to get these done only with the consultation of your doctor if need be. For all cases who don't develop severe disease, they can be managed at home. Here are few tips or guidelines. Any person who is found to be test positive or he suspects himself to be positive, he should self-isolate or self-quarantine. This isolation should be preferably in a well-ventilated room, if possible, so that the virus particles, they don't accumulate in that room and the risk of infection to others can be reduced. If the doors or windows of the room cannot be opened, we can make use of exhaust fans or air purifiers if possible. The persons who are taking care of these patients should need to take extra care. They should wear a double mask or they should wear N95 mask. They should try to maintain proper distance of at least 2 meters. They should be doing hand washing very frequently, and use of sanitizers should also be done more frequently. All patients should regularly monitor their pulse, their temperature, their oxygen saturation, their respiratory rate. The treatment to be given to the patient is purely symptomatic. That means the type of the symptoms the patient has, the type of the treatment is given accordingly. If a patient is asymptomatic, that is, there are no symptoms, then he doesn't need any medication. All patients should take proper rest and maintain proper hydration. They should take plenty of fluids, maybe it's water, maybe it is fruit juice, coconut water, or some soups. For fever, headache, or body ache, best is to take simple paracetamol. It may be 500 mg or 650 mg. Depending upon the severity of the symptoms, it can be given maybe once, twice, or 3 times a day. The common brands available are Crocin, Metacin, Calpol, Pyracetamol, or Dolo, or many others. Any brand can be taken. If the symptoms are more severe, fever or headache or body ache is more severe, one can take mefenamic acid or Meftal tablet twice a day. For sneezing, running nose, one should take tablets cetirizine or levocetirizine or levocetirizine M once a day. The common brands available are Allertec, Allerset, Ginsett, Cetirizine, Taxine, etc. Any can be taken. For stuffy nose or blocked nose, one can make use of decongestant nasal sprays or drops such as Otrivin, Sinarest, etc. For dry nose or dry crusty nose, one can use like saline drops or saline spray such as NasoClear nasal spray, etc. One can also use clarified butter or some oil in the nose. For irritant or scratchy throat, one should do povidone iodine gargles or saline gargles. The povidone iodine is available as like Vocadine, Betadine, etc. Steam inhalation, that is also very effective for this scratchy throat or irritation. Even some lozenges, it may be herbal or allopathic, like Sualin, Coughlette, or Cherry Cough. Any lozenges, these can be sucked. They are also very helpful. For dry cough, one can take syrups like Ascoril D, Zedex, Cherry Cough, Tuscu D. Any can be taken. Herbal concoctions as recommended by Ayush, they are also very effective for this. To maintain the immunity of the patients, vitamin C, zinc, vitamin D or multivitamins, they can be a good help. Consumption of neem leaves or haldi or turmeric is also very good. It boosts the immunity as well as it helps in beating the infection. If in spite of all this, the symptoms persist, there may be some secondary infection, so one may need antibiotics. That should be taken preferably with the consultation of your doctor. The role of antiviral drugs like favipiravir or the newly launched molnupiravir is still controversial. It is more effective when given early in the disease. They should only be taken by consulting your doctor. Don't take by self. Steroids, which were used very frequently in the infection by the previous variants, these should not be used in infection by this variant. They are required only in very limited number of cases, so take it only by the consent of your doctor. Otherwise, they can be more harmful rather than any benefit. The blood thinners, they are also needed only in very limited number of cases. Certain persons who, if get infected, need to be more careful, such as those who are not previously vaccinated, those who are immunocompromised, such as cases of cancer, it may be any type of cancer, then autoimmune diseases such as rheumatoid arthritis, IBD, ulcerative colitis, multiple sclerosis, psoriasis, etc. Certain patients who are already having some coexisting diseases such as diabetes, hypertension, heart disease, it may be coronary artery disease or heart failure or cardiomyopathy. It may be any lung disease such as bronchial asthma, COPD or pulmonary tuberculosis. There may be old age, gross obesity. All these condition cases, they need to be more careful. All such patients must continue their treatment which they are already taking. These are some signs. If they are found in any patient, we need to be extra alert. Number one is fever. If any fever persisting more than 101 degrees Fahrenheit for more than 3 consecutive days, continuously, we need to be more alert. Number two is oxygen saturation. If the oxygen saturation falls below 93%, we should be super alert. Number three, respiratory rate. If the respiratory rate of the patient exceeds more than 25 per minute, we should be very cautious. The patient usually is breathless. Number four, pulse of the patient. If it is persistently staying to more than 120 per minute, we need to be extra careful. Number five is mental confusion. If there are any signs like giddiness, the patient is having some forgetfulness, the patient is drowsy, or there is some irrelevant talk, or the patient is sleeping in between, then we need to be super alert. Number six, if the blood pressure of the patient is falling to less than 90 millimeter of mercury. Number seven, if the patient has not passed any urine in the last 24 hours, we need to be more careful. If any patient, we find any of these warning signs, then we must immediately try to contact the doctor at the nearest COVID care center and seek his guidance. I hope this video will be useful to many. If you have any questions, any suggestions, or you want to share any of your personal experiences with us, you are always welcome to write in the comment box, or you can email at the given email ID. If you find this video useful, you can like it or share it. If you want to receive more such like videos, you can always subscribe the channel. May God bless everybody. Thanks for watching.